everybody, this is Paul from Ortho Eval. What I want to talk about today is posterior capsular tightness and how it can cause impingement. So Brian here has been having some trouble with his shoulder, especially with overhead throwing activities. One of the things we've noticed is that he does have some positive impingement here. He doesn't go over very well, right there. And he has a very tight capsule, posterior capsule. His arm does not internally rotate. Look at his shoulder pop up here. Okay, so two of the things I'm going to be doing is just some low load, long duration stretching in the plane of the scapula, right like this. Okay, I'm not going to have him do crossbody activities to stretch that posterior capsule because it does cause a little impingement. So I like to manually stretch this for a low load, long duration. Okay. And the other thing I really like to do is stretch that posterior capsule. I take a roll like this, put it under his scapula, and I allow that to stabilize the scapula and glenoid while I take his humeral head and I distract him in that plane of the scapula again, and I bear some weight and I try to stretch that posterior capsule. Okay, and he really feels that, doesn't he? Okay. Some people will get a little bit of numbness or tingling down the arm. It stretches the brachial plexus a little bit, but I've never had any long-term problems with this. I am putting a significant amount of pressure. As you can see, my arm is shaking a little bit. I'm really stretching that posterior capsule and I'm holding that, okay? Now what we're gonna do is we're gonna pause. I'm gonna do just a couple minutes of treatment so it doesn't make the video too long. And we'll come back and I'll show you what his motion looks like, okay? Thanks. All right, folks, we're back. So we just spent a couple of minutes doing some low load duration internal rotation stretching like this. We put a little roll under here, did some posterior mobs of his capsule, and just want you to take a look at his internal rotation now. Look at that hand fall down here, okay? It's much more comfortable in that position, and I take him into flexion, and he goes up really easily, okay? So why is that so important? When we stretch, when this posterior capsule is tight, it's just like having a marble in my hand or a ball in my hand and I squeeze it. It's pushing it out this way. So it pushes the humeral head forward, causing more impingement. When we stretch that posterior capsule out, it allows the humeral head to draw back, and he has much better fluid motion. And the last time we did a couple mobs like this, his overhead motion and his pain level had decreased significantly. So just stretching that posterior capsule can be very important. There's many ways to do it, but the two techniques I just talked to you about are very, very effective and very safe to do with patients. So if you have any questions, make sure you contact me at paul@orthoevalpal.com, or else just leave a comment and I'd be more than happy to get back to you. Thanks.